I'd first like to give thanks to Jeff Dingsor, who's contributed his time and effort in editing this training module. That's special thanks to ACME Video Productions for contributing their time and support for developing this training module. The mission statement for the pediatric department is to provide consistent, compassionate bereavement care and follow-up for all perinatal, neonatal, and pediatric deaths throughout Hovnanian Children's Hospital and Jersey Shore University Medical Center. Death is a part of the natural life cycle, and in due course, it's an event we all face. Its touch is deep and profound, but the loss of a child is an unnatural event. It's counterintuitive to the natural order of things. And I believe death is a trauma. And dealing with the death of a child either in utero or post-delivery is complex trauma to the mother and to the extended family. Death as trauma affects us psychologically, physiologically, and spiritually. Grief is expressed in countless ways. People emote differently. Maleness and femaleness is a contributing factor, as well as cultural and religious upbringing. One of the most valuable tools we have in assessing where people are in their grief journey is through doing a comprehensive risk assessment. And that's what I would like to talk with you about today. How we approach the grieving and how we explore with them their present grief journey is vital to provide the proper grief support and care. Let me begin with several thoughts. The first thought I have is compassionate care for the grieving in all of its forms. And there are as many people as there are many, many ways to grieve. Sometimes we'll see someone who we think they've had a loss, and we see them, and we think that are they really grieving? On the outside, they may not look like it would be your traditional grieving, but oftentimes there are people who grieve internally. And so being aware and being able to assess and connected to them enough to know the way that they emote and they grieve is a very, very important process. We need to be actively present with them. And that's really the only way that we're really going to be connected enough to know their, quote, style of grieving. We need to listen, but not just listen to the words. We need to listen beneath the words. So for oftentimes, it's what they do not say, or what they say in a certain way, that there's a deeper meaning of what is going on inside of them. And then it moves us to being able to clarify. Not only clarify that we understand what they're saying, but we also clarify for ourselves the meaning of what they're saying. I had an old professor one time that told me many, many years ago that definitions lie in people and not necessarily in the word, and this is true. In this process, we build trust. Trust becomes a very, very important, if not cornerstone, to this whole process. That they know that we're empathetic, that we know that we're connected to them, that they know that we're listening, allows us and allows them to open up in a way that allows us to have insights into what's going on in a deeper way. Death is psychological trauma, as I had mentioned before. And the things that we need to be aware of psychologically is that we need to be aware of any type of indication of suicide ideation. Exploring with them. Again, that it's having that intuitive sense as we discuss with them and explore with them their grief. And part of this is not just a list of questions. You know, I'm going to give you 10 questions that I'm going to ask you. but it's in a natural form of conversation that we integrate into our conversation with them the questions that we're trying to get them to move to be able to answer. Is there any indication of self-harm? Are there issues of guilt? And this often comes up. I could have done more. I should have done this. I should have done that. I could have done this, or I could have done that. And is that driving them psychologically? Is it keeping them up at night? Is it changing their patterns of behavior? Anger is another psychological dynamic that happens. They're angry at everyone, angry at the doctors, angry at the family, angry at the other children. Anger emerges and can emerge in this, and we need to be aware, have there been any changes to their patterns of behavior related to anger? The death is also a physiologically and emotional trauma. What has changed in terms of sleeping patterns? Are they sleeping? Or are they able to go to sleep, but then they wake up and unable to go back to sleep? Are they unable to go to sleep? All of these are factors that in a conversational way we need to begin to understand in a deeper way. Have their eating patterns changed? Are they eating? Are they binge eating? Are they overeating? And again, what we really want to be aware of is any changes to what had been normal, what had been normal in the pregnancy, and have those patterns changed in these areas. Their social interactions, have they changed? Have they become reclusive? Are they not contacting their family, staying connected? Social events that they once thoroughly enjoyed and participated in, have they begun to drop off in a significant way? Also, the death is a spiritual trauma. And you can only imagine what oftentimes happens with people who are faith-based people, or people who believe in a higher power of God. They're asking, is God angry with me? Am I cursed? Is my family cursed? Did I do something wrong? Is God punishing me? Those are deep. And as you can see as I talk through these oftentimes overlap. It's not a linear, one is psychological, one is physiological, and one is spiritual. There's so much overlap during this time that we're in conversation and doing the risk assessment. And primarily, as you're going through these, we're asking, what has significantly changed prior to this? And that's part of getting to know them and connecting with the family as well. That allows you to have insight into what some of those patterns were. And as we move through that risk assessment, and we're looking at all of these areas, we're asking ourselves, at least I'm asking myself, as I'm connected to them, do they sense my empathy? Because probably empathy and connecting to them is the greatest way to use comforting, healing words that really can help them and to sustain them and to give them courage and strength during this time. What community resources are available to them? Are they connected to some social group, a church or activity, or a lodge, or some way that, or even extended family? What community resources are available to help them tap into to find strength and courage during this time? There may be groups that are out there. It's very difficult during this time of COVID. Extremely difficult for patients who have passed. For children who have passed during this time, and all of the social isolation and the funeral parlor issues, all of those are contribute to some of the struggles that the families have during this time. In that way, with the risk assessment, awareness, helping them to find and plug into social supports, family supports, you'll be able to help them to find comfort, strength, and courage to get through it. Thank you so much for your time, and we'll talk more about this at a later date. Thank you.